The social determinants of health are the conditions in which people are born, grow, live, work, and age, and are shaped by the distribution of money, power, and resources at a global, national, and local level. They are also responsible for causing disparities in health status. The health status of indigenous groups is usually lower compared to the rest of non-indigenous populations. Social factors such as smoking, unemployment, and the lack of a support system were found to lead to poor health outcomes amongst this group of peoples. A healthy upbringing involves the physical, social or emotional, and language or cognitive domains of development, all of which greatly influence factors throughout the lifespan. A child's education outcomes heavily depend on their family's socioeconomic status. Children from disadvantaged backgrounds are more likely to repeat grades and drop out of high school than children who come from families of higher socioeconomic status. Working conditions are mainly determined by employment conditions. They have a direct impact on health outcomes and are closely linked to increased injuries, chronic diseases, and mortality. Food insecurity is defined as the insufficient access to quality food due to a lack of money and other resources. Gender inequalities negatively impacts both men and women. Here are some examples of actions that can be taken to reduce gender-based inequalities. Access to healthcare services is defined as the timely use of personal health services to achieve the best possible health outcomes. Having a sufficient income is essential to leading a healthy life. Canadians with higher incomes experience better health outcomes than those with lower incomes. Social exclusion occurs as a result of dynamic, multidimensional processes driven by unequal power relationships that interact across economic, political, social, and cultural dimensions. Several developing countries are investing in social safety nets in order to improve the lives of their poor populations. Individuals who are without work during a reference period and are looking for work are deemed unemployed. Increased rates of malnutrition, unintentional weight loss, cardiovascular disease, and anxiety were observed amongst unemployed individuals. Race is the significant physical differences within specific societies, whereas ethnicity describes shared culture. Discrimination, racism, and segregation can inflict negative mental and physical health outcomes. Improvements in housing can lead to improved overall health. However, poor housing can also create negative health outcomes. Health-related quality of life outcomes decrease when a person with a disability encounters a barrier that reduces their ability to participate in daily activities. Access to and appropriate use of technologies involves recognizing the need to develop, deliver, and evaluate various new and innovative technologies to help support public health initiatives.